The Chalmers and other hospitals in New Brunswick do an amazing job at saving lives. In fact, in Canada, we're ranked right near the top of the heap in terms of saving lives when people find themselves in catastrophic situations, car accidents, and heart attacks, and those kinds of real emergency situations. And we do incredible work. Our doctors and nurses and health professionals are the best in the country in saving lives, and we've got the record to prove it. Where we have an issue is our hospitals have ended up also delivering primary health care, which is really not the place for primary health care. Everyone's had the experience of sitting in emergency rooms for hours upon hours upon hours to really seek primary health care, which is not the right place to go. But if there's no real alternative, then what are you going to do? I've had that experience with our children, spending a lot of time in waiting rooms, waiting to be seen by a doctor, really when we needed to see our own doctor or some kind of care that our own doctor might provide. On the other end of the situation, we've got seniors who are living in our hospitals. We've got seniors living in the Chalmers here where they really shouldn't be living here. I mean, what a way to treat our senior citizens. They're waiting to get into some kind of nursing care or nursing homes, and we just don't have enough beds for them. So that needs to be fixed. So on both ends of the hospital, we've got care occurring which is not really related to the core mission of our hospitals. That is to cure people's illnesses and treat their sicknesses, deal with disease, and repair broken bodies. That's something that we need to ensure hospitals can focus on. So the Green Party's approach would be to move the primary health care back into our communities, in community health centers, where our family doctors work in collaboration with a whole team of professionals such as nurse practitioners, dietitians, counselors, and that kind of expertise, so that you're a patient of a collaborative healthcare team. Your doctor is no longer working in solitary situations, and that means you're going to have more ready access to primary health care. You might not always see your doctor, you might see the nurse practitioner or the dietitian. It's going to be a great help for your family physician as well, because when they want you to take action on your diet or on exercise or on losing weight, then there's a team around the doctor who can help ensure that happens and work with you to help ensure that happens. The same goes for managing chronic disease. With that kind of collaborative healthcare team, with you as their patient, your doctor is going to be able to ensure that you're going to better manage that chronic disease and not end up in the emergency department in the hospital. So that's got to be a real focus. It's also going to really make a difference to mental health care. Mental health care in this province needs a lot of attention. It's ghettoized. It's not seamlessly integrated into physical health care, and I'm particularly concerned about our young people, where in a lot of cases mental illness first begins, are not getting the kind of diagnosis they need, so they're going undiagnosed, and when they do get the diagnosis, the care is just not there, the treatment is just not there. Sure, they can get a prescription, but that's not enough. And I know a lot of parents who are really concerned about the long waiting lists that their children are on to see a psychologist or a psychiatrist or to get counseling, and that's dangerous for some kids. They just can't wait. They need help now. And so we need to address mental health care in a fundamental way so that it becomes seamlessly integrated with the rest of our health care. And if we bring that back into the community in a more effective way, and it does need more money, it does mean we've got to invest on the mental health care side in particular to ensure that we treat mental health as seriously and with the same effort and attention as we do physical health. The same goes for reproductive health care. We have a crisis right now in Fredericton and in New Brunswick with the closure of the Morgentaler Clinic, so that when women who face a painful decision, which must be a painful decision, of having to terminate a pregnancy now, are left to really just turn to the Moncton Hospital or the Bathurst Hospital, and of course have to, under the current laws in New Brunswick, which are nowhere else in the country, seek the permission of 2 doctors to be allowed to terminate that pregnancy. That's not fair. That's not legal in Canada. We have the laws in Canada that say, you know, women should have that access, but in New Brunswick, women don't have that access. We need to provide that. We need to repeal the laws to eliminate the need to seek the permission of 2 doctors and ensure that safe, legal abortions are available. And the better setting for that is in a clinic setting or a community health setting, rather than hospitals where good counseling can be provided, where good aftercare can be provided, and really that just isn't the kind of care that can be provided in our hospitals. So we need timely access to physical, mental, and reproductive health care for people when they need it, and in the ways that they can best benefit from it. And that's not the situation right now. So we need to move out of the hospitals into the communities for the kind of primary health care, mental health care, and reproductive health care that New Brunswickers need.